Imagine you're on an operating table. Your mind? Totally awake. But your body? It's completely paralyzed. This is the deeply unsettling world of anesthetic awareness, and today we're going to dive right in and understand it.
Just listen to this quote. It comes directly from someone who's been through it. A mind just trapped, fully conscious, while the body can't do a thing. It perfectly captures the absolute helplessness of that situation.
So what is this horrible experience? What exactly is going on here? It sounds like something straight out of a horror movie, right? But it's a real, recognized, though thankfully rare, medical phenomenon. So let's break down exactly what it is.
The official term for this is anesthetic awareness. Basically, it's a state where a patient who's supposed to be under general anesthesia becomes conscious of everything around them. They can hear, they can feel, they can even form memories. But, and this is the terrifying part, because of the muscle relaxants, they are completely unable to move or signal that something is terribly, terribly wrong.
Okay, so to understand how this is even possible, we really have to look at what's happening inside the brain. Why does that off switch of anesthesia sometimes just fail?
General anesthesia is this incredibly delicate balancing act. It's designed to do two main things: suppress your consciousness and block pain. But the brain is just so ridiculously complex that sometimes that off switch doesn't flit for every single part. It leaves these critical areas totally online.
It all starts with a part of the brain called the thalamus. Think of it as your brain's main switchboard for all sensory info. Now, if the anesthesia fails to quiet this area down, the brain can start processing sensations from the surgery, things like touch, pressure, or even, pain.
All right, next up is the hippocampus. This little guy is your brain's memory maker. So if the hippocampus stays active, it starts doing what it does best: recording what's happening. And this is exactly why patients can later have these incredibly vivid, explicit memories of the whole ordeal.
And finally, we have the amygdala. This is the emotional core of your brain. It's our fear and panic center. So when it's active during one of these awareness events, it just floods the patient with this overwhelming sense of terror, which, as you can imagine, just amplifies the trauma of being awake and paralyzed 100 times over.
Okay, hearing all of this is, well, it's understandably terrifying, and it immediately brings up a huge question. Just how common is this? How likely is this to actually happen to someone?
Well, here's the good news. It is very rare, thankfully. Studies show it happens in just 1 to 2 patients for every 1,000 who go under general anesthesia. Now, that's a small number for sure, but for those few people who experience it, the impact is absolutely immense.
Yeah, because for the few who do go through this, the event doesn't just end when the anesthesia finally wears off. Oh no, the psychological impact can last a lifetime, and it creates this profound, confusing disconnect between what they remember and what was real. Now, this slide really gets to the heart of the problem. It shows this massive disconnect. On one side, you've got the patient's internal reality. They're hearing the doctor's chat, they're feeling the procedure, they're screaming in their own minds for someone to help. And then on the other side, what does the medical team see? A patient who looks perfectly unconscious. Their vital signs might be totally stable. There's just no outward sign of the absolute horror that's unfolding inside.
A lot of people who have gone through this compare it to the feeling of drowning. And it makes sense, right? It's that same sense of complete and utter helplessness, of not being able to breathe or scream for help, combined with that intense primal fear that you're about to die.
And the fallout from a trauma like this is, well, it's significant. It very often leads to serious psychological conditions, like anxiety disorders and PTSD. Patients can be just haunted by recurring nightmares. They also struggle with what's called perceptual confusion, constantly questioning if what they remember was real or just some horrible, vivid dream. And it can even lead to derealization, which is this terrifying feeling of being totally detached from reality itself.
So, with such a frightening possibility out there, what can actually be done? Well, the good news is that there are some really clear steps for managing both the risk and the after effects.
There are really 2 crucial things to keep in mind here. First off, preparation is everything. Just having an open, honest conversation with your doctor about anesthesia beforehand can seriously reduce your anxiety going in. And second, if this incredibly rare event does happen, it is absolutely vital to get psychological support right away. Professional help is just essential to process that trauma and learn how to cope with the experience.
And that brings us to one last, kind of lingering question. For a lot of these patients, the memory of being awake is hazy. It feels dreamlike. But does that uncertainty, that was it real or not feeling, Does it change the trauma? Does it make it any less real? It really forces us to think about the nature of memory itself and how even a reality we question can leave a permanent scar.